10 TV.
It's Stephen Imbide on Purpose Wechuga, now coming to you from Kiswa Health Center here in Bugorobi, because we know that medical doctors or medical officers that is under the Uganda Medical Association, yesterday they declared a strike, and in some parts of the country at least we saw those on duty were few, and in other parts at least there were many officers who were on duty, and others were physically on duty, but they were not doing anything as far as giving medical attention to the people who were going in there at the health centers and the hospitals. But here at the Kiswa Health Center, I'm here to establish what's happening here. The patients coming in, the medical officers on duty. At least when I got here at exactly 7:30, I saw some medical officers, and here I had to look for the in charge of this health facility to establish what's happening here. But on my left, the people who are coming in for COVID-19 vaccination, they are there, and I found there also the area leaders, the MP for Nakawa West, that is Balimwezo, is also trying to speak to those who are coming in for the COVID-19 vaccination, as well as the area member, that is Nakawa East Engineer Balimwezo, and also the MP, the mayor for Nakawa division, that is Paul Mugambe. They are trying to speak to the people. I think they are giving them some security and health tips. I'll be speaking to them later on. But let me first engage the nurses here. She is the senior nursing officer. She's the in charge of the Kiswa Health Center. This is none other than Nabukwasi Irene. Good morning to you.
Good morning, Stephen. Yeah. You're welcome. Kiswa.
Thank you, and good morning to you.
Good morning to you, Stephen.
First, update me. Many medical officers in some parts of the country were not on duty. I found you here at 7:30 already on duty. I just want to establish what was happening here yesterday. Many of your staff are absent from duty.
Yeah. Well, yesterday we had the medical doctors on strike and in other regions of the country. But for us here at Kiswa, work went on normally, and the health workers were on duty, and patients were being attended to without any problem. Even as I speak now, the health workers are already on duty. They've started doing their work. And I want to urge the community out there that they should come and get services, because the health workers are on duty. We are not on strike, us in Kiswa Health Center. Yeah.
Okay, and the name is?
Mary Muhanguzi. I'm a nursing officer. I work at Kiswa Health Center. As you are already aware, people even yesterday they were doubting that when they came in and they found us on duty, they didn't expect it. But as already the in charge of health center has already told you, we are available and we are ready to give service to our clients and patients.
Maybe for you who are available, not part of the Uganda Medical Association, that could explain why for you are on duty.
Well, we're not part of the Uganda Medical Association. For us, we are nurses, and even the other health workers are not part of the association. That's why they're on duty.
So services are ongoing here normally, uninterrupted?
Yes, services are going on well without any interruption.
Okay, thank you so much. Any last word to the people out there watching you here today on Morning at 10 TV? Of course, they could be maybe patients, they could be waiting for some attention.
Well, I want to urge them that they should come and seek services, because the health workers are available to offer the services. We are not on strike. Yeah, thank you.
Thank you so much. Now, for you as medical officers, what would you want to have in place for better health services, or at least to have a better conducive environment for you as nursing officers, but also as part of the medical profession? What would you want, not only here, but for the entire country?
Well, we want the health facilities to be provided with supplies to use. For example, we need the PPEs, we need the medicines and other supplies for the patients. We also need the welfare. We need the government at least to look into our welfare, like if they can maybe increase our salaries. Yeah.
Okay. Also, the issue of COVID-19 is a big challenge that we have as a country. You medical officers, some of your colleagues have lost their lives, others have gotten sick. but still the issue of compensation and also care for these people who are caring for others. How do you want this to be handled for the medical profession, those who are in the service of giving us better health?
To me, I think as the government, because most of us were infected, even our colleagues passed on, and up to now we are still at a very high risk. But I think the government should come in and as they promised that they should be compensate for our colleagues who passed on with their families. And maybe secondly, I also say, if it would be, as the COVID pandemic is still ongoing on, they would put us on risking allowance, which we expected, but I think we only received like twice. Up to now, there is no risking allowance, yet we are still ongoing with our patients and the clients at a very high risk. So if the government and the member of parliament, they could discuss this and they come with a resolution for medical workers.
Thank you so much. Maybe lastly for you as the medical officers is the issue of fighting the services, talking about HIV/AIDS. On December 1st, it's going to be the World AIDS Day. This is one of the health centers that's giving some care for those who are patients. Are we giving enough attention to HIV/AIDS in your view? And what should be done to ensure that at least there is better service for the people who are seeking services as regards HIV/AIDS?
I think as far as HIV/AIDS is concerned, we have a full clinic of HIV at Kiswa Health Center, and we have enrolled so many clients into care, and they are getting all their medications as they are supposed to. And we are doing our best to offer all the package that somebody who is infected with HIV is entitled to get, and they're getting that package.
Okay, and lastly for you is what would you tell those striking doctors who are off duty now? Patients are in the hospital, waiting for service, they are not getting it in some health centers or hospitals. What would you tell them? Because they are having a genuine reason, they were promised a salary increment, they were not given to them, but now they are seeking, they want their salary increment to be effected. What do you tell them?
I wouldn't say that the health, okay, our colleagues who are on strike, that the facilities are totally not giving services, but the few, because there must be a secretarial staff which is on ground, but the ones who have laid down their tools, that is a way they wanted to show the public the concern, because it has been too long. I think since 2016 they have been promising us, the government, even the president himself, saying the science, really my health workers, my doctors are doing a good job, but we are doing a good job, but in spite of the conditions which we are working on, because you find we are not really well motivated, even as we are here, because of the ethics which we have, but also inside us we are not feeling, we are not okay. We need also to be motivated, at least with a reasonable amount of salary or additional allowances which can be topped up on our salary. So, to me, I don't want you take this as that all the doctors who are on strike, that the health facilities are not giving the necessary facilities, only that now as a area, because if in the case of emergencies, all the patients or clients are handled. Because yesterday, like I saw, the Kawemp, they were showing Kiseny, but there were some secretarial staff which were on the ground. But I urge you, if you can really also push a voice to us, that let not only the promises remain in words, they should be in actions which could be taking place, so that also we are motivated. And really, you have seen with this pandemic of COVID-19, the importance of the health workers, what we have done, in spite of our colleagues who have died.
Thank you so much. The name is?
Is Mile Muhanguzi, Sister Mile Muhanguzi, working at Kiswa Health Center, Focal Person Nutrition.
Thank you so much, Miremo Hanguzi, Sister Miremo Hanguzi, and also the in charge of Kiswa Health Center, Irene Nabukwasi. Thank you so much for your time, and of course assuring the public that yes, they are here to give you services if you need them, and I hope you'll be able to find health services wherever you go across the country. I also saw, when I came in here, I saw the area leaders. I can see the division mayor, Mr. Paul Mugambe, together with the area MP, Engineer Honorable Balimwezo Nsubuga. He's here, and I found you trying to speak to these people here who are waiting for COVID-19 vaccination. I also wanted to have a word from you, as you were also trying to tell them whatever it is. Could it be health, security? I don't know, but I think we can still go back that side and still engage them as I still hear from you. But as we move, let me start with you, Mr. Paul Mugambe, as we face the camera. Yes. Good morning to you, and how's your morning?
Morning to everyone that is watching us. The morning we are here, we've come to check on our health centers. We started with Naguru. Now we're here to find out the situation as it is. Yeah.
And when you came in here, found you here, what have you found so far?
What I found here, I found a number of people here seated, waiting for services, and I asked them what the issue is, and they told me that they were worried that vaccination was not going to take place. They thought even the vaccinators are on strike. But I've called the person in charge, the DMO, the Division Medical Officer, Dr. Undo, and he has assured me that vaccination is going to go on, and very soon we shall have a team in place to have all these people vaccinated. So vaccination is not affected, and we call upon the people to come. But even generally, Kiswa Hospital, as you know, the strike is by doctors, and here we have one medical doctor. Most of the workers here, the health workers, are nurses, clinical officers, medical officers. So most of them are working, and the services are being provided, but we are still worried. And indeed we call upon the government, because the situation is Naguru. The situation I got in Naguru yesterday was really not good, the reports. So we call upon the government really to hasten the process of fulfilling its pledge of increasing the doctors' salaries, because in a few days, if this goes on, we may of our people. As you know, we live in a community that is really vulnerable. They cannot afford to go to private health facilities. So we call upon the government really to take this serious, to consider the plight of the doctors who do a lot of work to get out of this crisis as soon as is possible.
So also an issue of security, because when we see this gathering here and you the area of Nakawa, the issue of security should be handled in a way that is not in the ordinary times. We are now living in the era of fighting terrorism. What would you tell your people that you lead in Nakawa?
Indeed, in as far as the security is concerned, the biggest scare we have now is the bomb scare. And what we are saying is that the first line of defense is you, the person, is your eye, is your action. We are calling upon our people to be vigilant, to be observant. If you find a situation that is really suspicious, report it as soon as possible to us, to even other authorities, so that it is addressed. It's only then that we shall be able to fight, especially this bomb threat that we have.
Thank you so much. Let me also engage the MP, because this issue of services, or health services, also the remuneration for the health workers. You are the MPs, you will pass the budget. These people are saying that now they got the promise from the president for us to get a salary increment. These health facilities are in a dire need in their state. You are the area leader. What would you say about this situation when many of the health centers and hospitals, people are not getting the services they should be getting? Good morning to you, first of all.
Good morning to our viewers. My name is Ronald Balimwezo, the Member of Parliament of Nakawa East constituency. Yes, today we have come basically to check on our medical facilities because we are aware that doctors are on a sit-down strike because of their salaries increment. And there was a presidential directive to that effect. We only wonder why Ministry of Finance is not implementing a presidential directive. They are only working on matters concerning other sectors. Health sector is very, very critical, and as such, I think we need to basically focus on it so much, particularly during the COVID time, that our people are under threat. Therefore, I call upon all the key stakeholders to make sure that they look at this critically. I am quite aware that we are going to handle this today in Parliament, and you are going to hear hard voices come out to communicate to Ministry of Finance to make sure that they deal with the presidential directive. Secondly, I want to inform you that here work is going on as normal because particularly Kiswa hospital has only one single doctor, and it is a facility that is being basically we have majorly nurses, and all the nurses are around. We are doing immunization, and immunization is just...
A health center like Kiswa, serving so many people, having one medical doctor, isn't this a deficiency of the health system?
Definitely it is, but government tells us that they have limited funds. Like I did tell you that basically health is very critical, and our economy depends on a healthy community, because a diseased community is unproductive, and as such we have to see our people very healthy, and that's the reason that we should invest much more in the health sector. Unfortunately, we as a parliament, we see that, but at times we ask ourselves, where does this money go? And that is a question that we are going to insist on, and also make sure that we do our oversight role to see that actually money is expended as it's supposed to be. And we as leaders, we usually do that, and that's the reason that we are even here, to see that actually services are going on in the hospitals, despite the fact that we have low turn-up of staff, low staff in such facilities. But it's our role still to make sure that we do appropriate enough funds for these health facilities, because without the health sector operating normally and well, I think we shall have a diseased community which will be unproductive.
Also, I also want to pick your mind on the issue of terrorism, just like I did with Honorable Mugambi here. How do you think this should be handled? Because now police is doing, security is doing investigations, many people are being arrested, and of course, we know that this terror issue is still a big challenge that we are dealing with. How should it be handled?
Number one, police lost trust from the people. People do no longer trust police. So we need to rebuild confidence amongst the people through sensitizations. You know, today you report an issue at police, police comes and arrests that person, but police will tell the other culprit who actually brought the information. And this has totally messed up the entire system. Secondly, there is a lot of corruption in police that we need to fight if we to fight terrorism. We are all aware that it is our role as residents, as people, as community to fight terrorism. And as such, we need to basically work out that, because terrorism has no color. Insecurity has no color. A bomb can hit even your mother. And therefore, we should all fight this intolerable act and kick it out of the country. Believe me, there are some few... You have ended?
Just in seconds.
Yeah, I want to appreciate NTV for making such coverage so that we may inform exactly what is happening. Today here, the situation is a little normal. I want to appreciate the doctors in Nagulu, because yesterday I visited there, and at least the emergency section was working perfectly. People could not leave, others to go unattended to. I want to appreciate them, and we are still pushing on to see that the government actually looks into your issue. Please do work. I want to appreciate your passion towards humanity. May God bless you.
Thank you so much, Honorable Engineer Ronald Balimwezo, the MP Nakawa East, and of course His Worship Paul Mugambe, the Nakawa Division Mayor. Of course, we are still trying to find out what's happening in the many health centers. In Mabegawano, I can see many people, they came in here for COVID-19 vaccination. They are